Allrecht, Mama Stobe, welcome.
Let's talk about something super important, vitamins during pregnancy. You're growing a tiny human, and that's a big job. It's a time filled with excitement, anticipation, and a whole lot of questions. And one of the biggest questions I hear all the time is, what vitamins do I really need during pregnancy? I get it. You're bombarded with information. Every article, every friend, every well-meaning relative seems to have an opinion on what you should be taking. It can be overwhelming.
So, let's cut through the noise and get down to the essentials.
Think of this video as your friendly, expert guide to navigating the world of prenatal vitamins. I'm here to give you the straight scoop, based on science and best practices, so you can make informed decisions about your health and your baby's development. We're going to cover the absolute must-have vitamins and minerals for pregnancy, explain why they're so crucial, and discuss the recommended dosages. We'll also touch on some common misconceptions and potential risks of taking too much of certain vitamins. But before we dive in, let me be clear, I'm not here to replace your doctor's advice. This video is for informational purposes only, and you should always consult with your healthcare provider before starting any new supplement regimen. Every pregnancy is unique, and your doctor can tailor recommendations to your specific needs. So, are you ready to learn about the vitamins that can help you have a healthy and happy pregnancy?
Great. Let's get started.
First things first, let's address the elephant in the room, food. A healthy, well-balanced diet is the foundation of a healthy pregnancy. Think of vitamins as supplements to your diet, not replacements for it. Load up on fruits, vegetables, lean proteins, and whole grains. These foods provide a wealth of nutrients that are essential for both you and your baby. However, even with the best diet, it can be challenging to get all the nutrients you need during pregnancy. That's where prenatal vitamins come in. They're specifically formulated to fill in the gaps and ensure you're meeting the increased demands of pregnancy. Okay, so what are the key players in the prenatal vitamin game? Let's start with the undisputed champion, folic acid. Folic acid, also known as folate, is a B vitamin that is absolutely critical for preventing neural tube defects in your baby. These defects, such as spina bifida, occur very early in pregnancy, often before you even know you're pregnant. That's why it's so important to start taking folic acid before you conceive, if possible. The recommended dosage of folic acid for pregnant women is typically 400 to 800 micrograms mcg per day. Your doctor may recommend a higher dose if you have a history of neural tube defects or other risk factors. Now, let's talk about iron. Pregnancy increases your blood volume by about 50%, which means you need more iron to produce enough red blood cells to carry oxygen to both you and your baby. Iron deficiency can lead to anemia, which can cause fatigue, weakness, and an increased risk of preterm labor. The recommended daily intake of iron during pregnancy is 27 mg mg. You can get iron from foods like red meat, poultry, beans, and leafy green vegetables. However, many women find it difficult to get enough iron from diet alone, so a prenatal vitamin with iron is usually recommended. It's important to note that iron can cause constipation, so be sure to drink plenty of water and eat fiber-rich foods. Your doctor may also recommend taking a stool softener if needed. Also, iron is best absorbed when taken with vitamin C, so consider taking your prenatal vitamin with a glass of orange juice or a vitamin C supplement. Next up, let's discuss calcium. Calcium is essential for building strong bones and teeth in your baby. If you don't get enough calcium from your diet, your baby will draw it from your bones, which can increase your risk of osteoporosis later in life. The recommended daily intake of calcium during pregnancy is 1000 mg mg. You can get calcium from dairy products, leafy green vegetables, and fortified foods. If you're not getting enough calcium from your diet, your doctor may recommend a calcium supplement. Vitamin D is another crucial nutrient during pregnancy. It helps your body absorb calcium and phosphorus, which are essential for bone development. Vitamin D also plays a role in immune function and may help reduce the risk of preterm birth and other complications. The recommended daily intake of vitamin D during pregnancy is 600 international units IU. You can get vitamin D from sunlight, fortified foods, and supplements. Many prenatal vitamins contain vitamin D, but you may need to take an additional supplement if you're deficient. Iodine is often overlooked, but it's incredibly important for your baby's brain development. Iodine deficiency during pregnancy can lead to cognitive impairment and other neurological problems. The recommended daily intake of iodine during pregnancy is 220 micrograms mcg. You can get iodine from iodized salt, seafood, and dairy products. Many prenatal vitamins contain iodine, but it's important to check the label to make sure you're getting enough. Now, let's talk about omega-3 fatty acids, specifically DHA. DHA is crucial for your baby's brain and eye development. It also plays a role in reducing the risk of preterm birth and postpartum depression. The recommended daily intake of DHA during pregnancy is at least 200 mg mg. You can get DHA from fatty fish like salmon, tuna, and sardines. If you don't eat fish regularly, you may want to consider taking a DHA supplement. Look for a supplement that is specifically formulated for pregnancy and that has been third-party tested for purity and potency. Okay, so those are the big ones: folic acid, iron, calcium, vitamin D, iodine, and omega-3s. But what about other vitamins and minerals? Many prenatal vitamins also contain vitamin C, vitamin E, B vitamins, zinc, and magnesium. These nutrients are also important for a healthy pregnancy, but they're generally found in adequate amounts in a well-balanced diet. Now, let's address some common misconceptions about prenatal vitamins. One common misconception is that you don't need to take prenatal vitamins if you're eating a healthy diet. While a healthy diet is essential, it's often not enough to meet the increased nutrient demands of pregnancy. Prenatal vitamins are designed to fill in the gaps and ensure you're getting everything you need. Another misconception is that more is always better when it comes to vitamins. In fact, taking too much of certain vitamins can be harmful to both you and your baby. For example, excessive intake of vitamin A can cause birth defects. Always follow the recommended dosage on the label and talk to your doctor if you have any concerns. So, how do you choose the right prenatal vitamin? First, look for a prenatal vitamin that contains all the essential nutrients we discussed earlier: folic acid, iron, calcium, vitamin D, iodine, and omega-3s. Second, choose a prenatal vitamin that is easy to swallow and that you can tolerate. Some prenatal vitamins can cause nausea or constipation, so you may need to try a few different brands to find one that works for you. Third, consider the form of the vitamin. Prenatal vitamins are available in a variety of forms, including tablets, capsules, gummies, and liquids. Choose the form that you find easiest to take and that you're most likely to stick with. Fourth, look for a prenatal vitamin that has been third-party tested for purity and potency. This ensures that the vitamin contains what it says it does and that it's free from contaminants. Finally, talk to your doctor about which prenatal vitamin is right for you. Your doctor can take into account your individual needs and health history to recommend a prenatal vitamin that is safe and effective. Remember, prenatal vitamins are not a magic bullet. They're just one piece of the puzzle when it comes to a healthy pregnancy. It's also important to eat a healthy diet, get regular exercise, get enough sleep, and manage stress. Taking care of yourself during pregnancy is one of the best things you can do for your baby. By making smart choices about your diet and supplements, you can help ensure that you have a healthy and happy pregnancy. So, there you have it. The essential vitamins for a healthy pregnancy. Remember to talk to your doctor about your individual needs and to choose a prenatal vitamin that is right for you. And most importantly, take care of yourself and enjoy this amazing journey. Now, I'd love to hear from you. What are your biggest concerns about prenatal vitamins? What has your doctor recommended? Share your thoughts and questions in the comments below. And don't forget to subscribe to my channel for more expert advice on pregnancy and women's health. I am here to help you navigate this amazing journey with confidence and knowledge. Let's make this pregnancy the healthiest and happiest one yet.